Hi, my name is Dr. Pecoraro. I'm a chiropractor. I graduated from Columbia Institute in 1975, and this is 2011, so that's almost 40 years. And this video is for other chiropractors. And over the years, many of us develop our own variations on techniques. I'm sure you have. And I thought I would show you one of the variations of one of my techniques. Now, many patients are afraid to have their neck adjusted, and some of them really don't want you to do it at all. So I've developed this one technique that is helpful, I find helpful, and you might too. Now, this is mostly I'm going to be showing you for cervical rotations. And since this is for chiropractors, I'm going to be speaking in chiropractic language to discourage others from using this kind of technique on their friends, because you can hurt somebody if you don't really know what you're doing. There's a lot of things you need to know besides what I'm telling you. So, let's say this person is sitting on the end of the table and they're looking this way, and they have cervical rotations with the body's right, the spine is left. In this particular case, what I would normally do is have the patient take their arm that's on that side and put their hand right on their head, about that right here. And I make my contact on the area, lamina, or whatever, wherever you want to put the contact. I'd make the contact with this part of my hand and grab my own wrist like this. And then I have the patient, I tell them, push your head against my hand. And if they're afraid, or if they're in a lot of pain, it's going totally by their force. So they know what they can take, they know what's hurting, they know what they're not afraid of. And I just keep my hand there as they move back on it, and I'll tighten my hand up and maybe do the tiniest thrust. Maybe no thrust at all, just kind of push it against their neck as they actually let them push their neck against my hand. So that's one technique. Another technique, another way I would do this, so let's say there's a left body rotation here with the spine, left body rotation with the spinous right. In this case, I normally would take the same area of my hand, place it on the lamina, and contact the head as I would for a sitting cervical rotation. Only thing you have to be careful of is your legs. Sometimes it's a little awkward with where your legs are with the patient. So practice it a little bit before you do this on someone. Anyway, so you have the contact with your hand, and with your other hand is placed on their head, and you take the traction out like you normally would, the rotation, the lateral flexion, the extension. But instead of thrusting, what you do is the thrust is almost like, if you can say that the vertebra was the top of a jar and you're unscrewing it. And you kind of do that kind of motion, but without a real thrust, more of a twisting motion, but with pressure on the area. And I find that most patients do not mind this particular technique for their neck, whereas they may be leery of any of the other techniques. So I hope this has been helpful to you, and try it, see how it works for you, and maybe I'll show you something else another time. Thanks.